Hello all. Today, November 7th, is National Cancer Awareness Day. As November is National Lung Cancer Awareness Month, let's explore what lung cancer is and how it can affect us. Now, what is lung cancer? Lung cancer is a disease that begins in the cells of the lungs. Let's take a closer look. The smiley faces represent healthy cells, and the angry faces represent cells with cancer, also known as cancerous cells. As you can see here in this person's lungs, they only have one cancerous cell. But because of cell division, like mitosis, the cancerous cells multiply in number. One seemingly harmless cancerous cell turns into two cancerous cells. Then two cancerous cells become 4, and 4 becomes 8. These cells multiply and multiply until there are no more healthy cells in the lung. The entire lung is made up of cancerous cells. But specifically, how does lung cancer spread? How do these cancerous cells enter your body? Well, a carcinogen is any substance that contributes to the formation of cancer. There are over 5,300 chemical compounds found in cigarette smoke, including over 60 known carcinogens. Vapes also promote cancer formation. A person's DNA carries the genetic information that codes for every function in the human body. Each cell in your body theoretically should have the same DNA sequences, but over time changes accumulate. When these changes, also known as mutations, accumulate, functions change in the cells. Some processes are weakened, like DNA repair, and other processes are heightened, like uncontrolled cell division. Cancerous cells are different from normal cells in that they divide uncontrollably, avoid the immune systems, and grow into and damage tissues and organs. As cancer cells divide, a tumor will develop and grow. Cancer cells need a blood supply to bring oxygen and nutrients to grow and survive, just like normal cells. As a tumor gets bigger, cancer cells can spread to surrounding tissue or a new location in the body through the blood or lymphatic system. But let's look at this scenario. Hey, are you okay?
I have a horrible cough and I can barely stand up straight because of my chest pain. Can you help me?
Yes, I'm a doctor. Let's get you checked out right away. The most common symptoms of lung cancer are a cough that does not go away, coughing up blood or rust-colored spit, chest pain that is often worse with deep breathing, coughing or laughing, hoarseness, loss of appetite, and shortness of breath. But in order to diagnose lung cancer, your doctor will ask you about your medical history, such as smoking. Then they may need imaging tests and biopsies of the lung. Imaging tests use X-rays or other substances to create pictures inside of your body. Using these images, the doctor will look for abnormal areas in the lungs. Biopsies may be done to get a sample from the suspicious mass. If cancer cells are indeed found, the doctor will determine if the patient has small cell lung cancer or non-small cell lung cancer. Small cell lung cancer can affect anyone, but typically affects people who have a long history of smoking. Small cell lung cancer, or SCLC, is usually characterized by smaller-sized cells that grow and spread quickly. There are two types of SCLC, small cell carcinoma and combined small cell carcinoma. Non-small cell lung cancer, or NSCLC, is usually characterized by larger-sized cells that grow and spread slower than SCLC, but NSCLC is often diagnosed after the cancer has spread. Early detection is essential. There are three main types of NSCLC: adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. There is not a particular action that causes NSCLC, but smoking is a risk factor. Once you have lung cancer, there are treatments you can undergo. People can undergo surgery to surgically remove the tumor or lung. External radiation therapy uses a machine to deliver strong X-ray beams directly to the tumor. This therapy can kill cancer cells and relieve symptoms of cancer, but this radiation can cause other side effects like nausea and tiredness. Another kind of treatment is chemotherapy, which is a therapy given intravenously or through a vein. It is used to stop or slow the cancer's growth, but chemotherapy also has other possible side effects like radiation therapy. These treatments are all effective ways to manage lung cancer, but the best way to treat lung cancer is to not smoke. Smoking or being exposed to second-hand smoke is the largest risk factor for developing lung cancer. Here are some other things that you can do to lower your risk. You can eat a healthy diet with lots of fruits and vegetables and exercise regularly. You should also avoid exposure to cancer-causing agents and radon. But once again, the most important thing is to not smoke. As we wrap up this video in understanding lung cancer, be sure to spread awareness about what you learned. Advocate for more research funding. Share your experience with lung cancer screening to encourage others to get screened. Join fundraising events, but not just for lung cancer. Spread awareness for all types of cancer on National Cancer Awareness Day. Thank you and happy National Cancer Awareness Day.